Okay guys, so this video we're going to go through a quick or couple of pointers with hip observation. Obviously hips are really related to lumbar spine, so you're going to look at the lumbar spine. Go back, we've got obviously the lumbar spine video, so you can have a look at the observation and inspection video on there. And the main things we wanted to discuss with the hip, so Karina, if we get you around this way, so just sideways on you, perfect. So the first thing would be your pelvic tilt. So obviously we want to look for the pelvic tilt, PSIS, ASIS, and look at that, see whether there is that hyperlordotic position. And we're talking about that being a risk factor in impingement type conditions. And then the other thing we often look for, if we go to the front, would be feet position. So we'd look down at the feet position and see whether there was that external rotation of the feet or internal rotation of the feet. So just looking to see what their hips naturally do in that position. Obviously, again, I would potentially as well from the front look at hip heights. So looking at just generally if there's a big discrepancy. Again, I'm not one of these that says you go and try and say it's a tiny little difference, but you certainly could just have a look and see whether there was a big discrepancy or really weight bearing on one side, on one hip. Obviously, like all your body parts, you'd be looking for any redness or swelling around the joint, as well as bruising or any deformity as well. So you're looking at those general observation issues, as well as those other things we've mentioned. I don't know, is there anything else that you would look for in a hip then? Or?
Yeah, I mean, I would always have an idea of what their presentation was, so if they were coming with anterior hip pain, then you might spend a lot more time looking at the pelvic position. Is it in increased anterior tilt? Because that will have a direct influence on that structure.
Yeah.
If it's more lateral hip pain, that may be slightly less relevant, and I might be concerned with, are they leaning one side more and creating that pressure on the glute med tendon, for example. If they're a younger patient, they've got posterior hip pain, then you might tend to see them in that sway back position, closing down the joint more posteriorly. So yeah, just having an idea of what the symptoms they're presenting with are, and can you tie that observation into that at this stage.
And I think that in this video is just meant to be a quick observation video, but in future videos and other videos on the section or on the site, we'll be going through kind of differentials and more how you navigate through the assessment. So not just actually learning the assessment themselves, but also then how you'd piece this all together. So this is just a quick video on the observation of the hip, but for future videos, just go to the site.